All right, good evening, everybody. We are going to be starting lecture for the 101-2 module. Today, we're going to be focusing on the circulatory system. And you can find all of the information for this PowerPoint in your textbook, chapter 7. This is going to be your orange VA textbook. All right. And this is a supplemental PowerPoint that I kind of created. I took all the info from the book to help you guys do assignments. So getting into the components of the circulatory system, we're going to have a few different organs and structures. What we're going to look at mainly is the heart, the veins, and the arteries. And I'm going to teach you guys about the flow with all of that as well. Breaking down the blood, there is red blood cells, white blood cells, platelets, and again, I'll be looking at the blood flow. So when you see RBC or WBC, RBC stands for red blood cell, WBC is white blood cell. I'll also go over normal versus abnormal vitals and problems and conditions that can occur within the circulatory system. So first I want to get into talking about the blood. So hematology is the study of the blood, and in the veterinary field, we will be doing a lot of work with blood and hematology. Some tools that we're going to use within the clinic are centrifuges and microhematocrine centrifuges. And this is equipment that we are going to use specifically when we are testing the blood. We can load the blood tubes into these centrifuges. It's kind of like a disc circle-like machine, and it will have different holes for the blood tubes to sit in. What it's going to do is when you turn it on, it's going to spin these blood tubes at a really, really high velocity. And as it does that, it's going to separate the red blood cells from the plasma. So blood is composed of two different things. We have the cells, red blood cells, compacted red blood cells, and then the plasma, which has all of the proteins and fibrinogen. So it's usually about a 45 or 40% red blood cells and 60% plasma. That's usually average that we see when we spin it down. In the cells that are in the blood, we're going to see erythrocytes, leukocytes, and platelets. Erythrocytes, that is our scientific name for our red blood cells. Again, that's RBC, abbreviated to. And leukocytes is the scientific name for the white blood cells, as also abbreviated as WBC. Then we have the platelets. Those are going to play a major role in the clotting factors for our patients. Some more components of the blood. We're going to see several proteins in the blood, such as albumin, globulin, fibrinogen, and serum. So albumin is going to help draw water into the vessels by a process that we call osmosis. So going to help provide hydration for the body. Globulin is going to provide antibodies to help prevent disease. Fibrinogen is also a protein that's going to aid in blood clotting. And serum, that is actually the fluid that we're going to use to run chemistry profiles to determine organ functions. Now, I do want to clarify that plasma and serum are very, very similar. So when we spin down these blood tubes, we are going to be using two different types of tubes. One is a tiger top tube, which will actually have a clump of like thick serum at the bottom, which when you centrifuge, it's going to then be the middle separation between the red blood cells at the bottom and the serum that's sitting on top. Now, if we use a red top tube, this is still a clotting factor tube. So when we spin it down, it's still going to separate the red blood cells out, but it's going to leave plasma on top. Now, the difference between serum and plasma, they're basically the same. There's one difference. So in our plasma, that is where we find fibrinogen. So if we are trying to do blood clotting tests and we suspect that our patient is having trouble clotting with their blood, this is really important, especially when they get a wound. Think about those clotting factors. The blood will actually start to clot and stick together, which will then form that barrier, which will dry into a scab and help with healing. If they have blood clotting issues, they're not clotting effectively, it could be because they have a decreased amount of fibrinogen in the blood, and we would need to run a specific fibrinogen test on that plasma. And don't worry if me talking about blood tubes sounds like a foreign language to you. If you have not taken module 106, which is diagnostic imaging and procedures, that is where we go over all of these different blood tests, all of the different tubes that we use and why. So don't worry, you will get well-versed in that when you get to that module. I'm just giving you a brief overview so that you can kind of see the differences between the two. So again, plasma has fibrinogen, serum does not. Plasma is what we're going to give in plasma or blood transfusions because we need fibrinogen, we need those clotting factors, but we can still use plasma for a lot of our blood testing, especially with chemistry panels. Now, breaking it down a little bit more, I'm going to talk about our red blood cells, hemoglobin, and white blood cells. So again, we know that our red blood cells are the erythrocytes. And these are the most abundant cell that we're going to find in the blood. The main functions of the red blood cells are to transport O2 throughout the body. Now, O2, you guys, that stands for oxygen. So it's going to help transport the oxygen throughout the body through that circulatory system. And then we'll also see the process called erythropoiesis, which is the production of red blood cells in the bone marrow. So these red blood cells, they're constantly being reduced and replaced throughout the body. It's a constant circulation. Now we're also going to see that red blood cells can connect with hemoglobin. Hemoglobin contains iron and is responsible for oxygen transport. So it's going to be helping those red blood cells transport around the body. And then we have white blood cells, also known as leukocytes. And these are the body's main defense against infection. So when an infection or an inflammatory response occurs, we're going to see an increase in white blood cells. So if we were to do a CBC, also known as a complete blood count, and see increased white blood cells, that would indicate that there is an infection in the body. Now, that being said, there's about 5 different types of white blood cells. We have neutrophils, lymphocytes, eosinophils, monocytes, and basophils. And depending on which white blood cells you see upon interpretation will tell you what type of infection that we're dealing with. So to break it down a little bit further, we have our neutrophils. These are going to eat and destroy the microorganisms in the tissues. Oh, sorry about that. Now, the mature cells with the neutrophils, they're going to contain a nucleus that have segments or what we would call divisions. Nucleus, that's going to be the center of the cell. Now, they also, when they are immature, are considered to be band cells. So band cells are those immature cells of the neutrophils, so they're still in the developmental stages, and they're actually shaped like a U. And this is really important more on blood smear interpretation. When we are testing the blood, we're going to be looking at the CBC blood count. So we'll look at white blood cells, red blood cells. And as we're interpreting these blood cells, we also need to see what developmental stage that they are in. Are they just developing? Are they fully mature? And that's going to also indicate how severe the infection is. So with these blood smears, we're going to be smearing about a drop of blood onto a slide, a glass slide, and then we'll stain it through our triple dip stain system. It will uptake the violet purple stain, and that's what's going to help us see and read these cells upon interpretation under the microscope. Now, again, you guys will get to do this in lab, so don't worry if this sounds a little bit foreign to you. This is a very common blood test that we'll be performing. As assistants, you guys, your main job is going to be prepping these blood smears for the doctors or the technicians to evaluate. So you won't necessarily have to evaluate them. However, you definitely can learn. But it is something that does take a lot of practice, and even still is something that the veterinarians will send out to the pathology labs just because they are specialists in interpretation. Now, getting back into our neutrophils, talking about those band cells, again, if we see those present in these blood smear slides, that is going to indicate that there is infection in the body. And these are actually the most commonly seen white blood cells that we'll see in the blood. Next, we have our basophils. And the basophils, they're going to stain really dark, which means that when we're putting the blood slide through the triple dip stain, we have a blue stain, which is like a preparation, the red stain, which is a fixative, and the purple stain, which is going to uptake all of that color into those cells for us to be able to easily read them. Now, with that, these basophils will uptake that purple stain. They'll stain really, really dark. And they also have a lot of different granules around the cell, as well as that segmented nucleus. Now, we see basophils present when there is an allergic reaction happening with our patient. And these granules that we're going to see with the basophils, they contain what's called a histamine. And a histamine is going to cause that reaction. So it will cause that inflammatory response, swelling, heat. So we have to counteract that. How we're going to counteract that is we're going to give an antihistamine. We're going to usually give a drug called diphenhydramine. Does anybody know what diphenhydramine is? And I'll give you a hint. It's a really common allergy medication that you can get over the counter, and it starts with a B. Again, I'm wanting to know the common name for diphenhydramine. You guys know what diphenhydramine is? You guys can type it in the chat.
Benadryl?
That is correct. Diphenhydramine is Benadryl. Good job. Wonderful. Let me get this chat over here. Sorry, guys. Perfect. Wonderful. So Benadryl is really common. We use it in the vet field all the time. And again, the drug name for Benadryl is diphenhydramine. And we can give this as an injection for our patients to help counteract that reaction right away. Some more of our white blood cells, we have monocytes, and monocytes are going to develop into macrophages that will eat and destroy organisms at certain locations of the body. So that's going to be good and bad. They will help remove organisms and dead cells, also other foreign particles that might be present. Think of like if they got a wound and there was foreign, dirt and particles that were present in that area. They're going to also help the neutrophils, which again, as we know, those neutrophils are kind of the main white blood cells that we're going to see in the blood. So they'll work together. And monocytes are actually the largest of the white blood cells. So when we see them on an interpretation, they are going to be significantly larger than the others. Next, we have eosinophils, and these are going to be really similar in appearance to the neutrophils. And this is due to the segments that is found in the nucleus. We will see a larger number of granules present in the cytoplasm. And again, we know that these granules can help control that inflammation. And they are going to fight against parasites and allergic reactions. Now, guys, thinking about parasites, what are some examples of some internal and external parasites that we might see present with our patients? Does anybody know some different parasites, internal or external, that we're going to see in our patients? You guys can use the chat or you can just unmute. So we have worms, but I'm thinking of what kinds of worms? What do you think we're going to see present, you guys? What are some external parasites? What are things that ringworm is a great external parasite? Ringworm is a fungal infection that can happen on the skin. What are some other parasites that we can find? Yes, Nathalie, that's going to be fleas. Fleas are an external parasite. Anyone else? Absolutely, Hannah. Ticks are one of them. Yep, Jennifer, you're right. Scabies is also in that class. Awesome. So those are all going to be external parasites. Now, internal parasites, I'm going to be looking at different parasitic worms that can be found throughout the body. So specifically for the circulatory system, one of the worms that is going to be the most harmful is heartworms, because they actually make home in the heart and are produced there. Now, some other worms that we're going to see, we have like roundworms, lungworms, hookworms. There's quite a few tapeworms that we can find throughout the body. And again, this is kind of going to be covered more in your diagnostic procedures module, which is 106, because we'll go over how to test for all of these. Anyone has any idea? How do we test for parasites? Do we test the blood? What do you guys think? What type of sample would I test if I'm looking for a parasite? Yeah, Nathalie, I'm going to be looking at the fecal matter. Absolutely. So when they have intestinal parasites, you guys, they're going to be expelling as they defecate in their stool. We're going to find the casings and the shells of these internal parasites. So we'll do a fecal test, which can include a fecal float or a fecal smear. All right, so into more factors with our bloods, we have the lymphocytes. And these lymphocytes, they are single nucleus cells. They're going to help aiding in those immune functions for the body, helping produce antibodies to fight disease, and they are considered to be the largest part of the blood. We then have platelets, and they will aid in the clotting time of the blood. And after there is any injury to a blood vessel, the vessel is actually going to start to constrict. So it'll get smaller, it's going to constrict. And the platelets are what going to help attach to that wound site to help plug, the wound or the hole that might be there and decrease the bleeding. So they're going to kind of attach together, bind together, trying to stop the bleeding. Eventually, they're going to start to dry out and become that scab, which will then aid in protection for that wound. Now, we can see cell fragments of platelets, especially when we do blood smears, and these are known as thrombocytes. And they look like little small dots kind of at the site of where the T's can be found. So moving past blood and all the components in the blood, I want to talk about the main organ that we're going to deal with in the circulatory system, which is the heart. So this image here, we're looking at the dorsal aspect of the heart here. So the front part of where it's going to sit in their chest. We orient the heart by the apex, which is found here on the caudal aspect of the heart. And as you guys can see, the heart has many, many, many different valves and arteries, as well as ventricles, which are the muscle layers that's going to help pump the blood through. And I'm going to talk about the blood flow a little bit after we talk a little bit about the heart itself. So many different vein and artery access. And looking at now the ventral aspect of the heart, again, we orient it by the apex down here. We're going to be looking just at the backside here at the different arteries. This vena cava here is one of the biggest branches. And again, those ventricles are going to be the muscular walls of the heart that's going to help pump the blood flow through. So we know that the heart is located, it's going to be low in the chest, and it sits centrally between the two lungs. Now, the heart is encased in what's called the pericardium, and this is like a fine membrane. It's actually a lining that goes around the heart that's going to protect the heart and also allow it to beat. Now, when we're listening for the heartbeat in our patients, although it does sit in between the lungs, it's actually a little bit off to the left. And we can hear it stronger on the left side. So we'll actually put the bell of the stethoscope right behind the elbow on our patients, right on the rib cage, and that's usually on that left side where we can hear the strongest heartbeat in our patient. Now, some patients, if they're deeper chested, like let's say a Rottweiler, we might actually have to move it more ventral and down onto that ventral aspect of their thorax to hear the heartbeat. And sometimes patients are odd and we've got to switch it over to the right side. And sometimes we hear it better from there. But rule of thumb is to listen from the left side. Getting back into the components of the heart here, going from the pericardium, we have the myocardium. And the myocardium is the main cardiac muscle, also known as the heart wall. Then we have the ventricles, and the ventricles are going to be what allows the blood to flow in and out of the heart. So these are thick-walled muscular vessels, and they're going to help carry the blood away from the heart. So pumping it away into the lungs to get reoxygenated. Then we have arteries, and these are used as pulse points throughout the body. So we have actually two different pulse points that we can really use for our patients to determine the heart rate. So if putting a stethoscope and listening on a stethoscope is not an option for that patient, there are two different locations that we can use these pulse points through arteries. Now, one of the most common ones is the femoral artery. Guys, where do you think you're going to find the femoral artery? What does femoral sound like? Femoral artery. I'll give you a hint. It sounds like a bone that can be found in the leg, specifically the back leg. Again, femoral artery. What does that sound like? Think of that big bone.
The femur?
Yes, that is correct. So the femoral artery is going to be found right along the medial aspect, so the inside of the back legs, right along where the femur is. Good job. So that femoral artery, we can actually kind of cup our hands around our patients and feel on the medial aspect of that back leg. And we can take a manual heart rate from that pulse point. Now, the other pulse point that we can use that's on our patients is also going to be found on the ventral aspect of the tail. So if we feel underneath the tail, they have a large artery running through that, and we can feel that pulse point there. So two different options. If for some reason, like let's say they were doing, cardiac surgery on the heart, we could still take an effective heart rate from the femoral or from the artery found on their tail. Now, the next site of blood flow for how the blood is going to be pumping through the heart with using those ventricles, we're also going to see the pulmonary arteries come into play. So the pulmonary arteries, they are going to carry the oxygen poor blood and keep it from allowing to flow back into the heart. So it's going to take this oxygen poor blood into the lungs to get reoxygenated. And again, O2 stands for oxygen. Now getting into a little bit more of the blood flow with the certain portions of the heart. So that vena cava, again, that's that large vessel that takes blood to the heart. Getting back to those directional terms, cranial, we know that means towards the head, caudal towards the tail. We have the right atrium, which is a thinner walled chamber. The right ventricle, which is that thicker wall that's going to help pump blood into the lungs. Then we have the right AV valve. And when we're talking about a valve can open and close. That's a purpose of these valves. So this right AV valve is going to help separate the atrium and the ventricle from each other. And it's also going to open and close to allow for blood flow as the heart is beating. And you'll notice we have the right side, and then we also have the left side. So again, left atrium is going to go into our left ventricle. There is that left AV valve, again, allows for that opening and closing for the pumping of the blood as the heart pumps in and out. The left ventricle is considered to be the thickest of all four chambers. Again, they are a large muscle in the heart. Then we have the aorta. And the aorta is actually the largest artery that we can find in the circulatory system. And this is going to prevent the blood flow to go back into the heart. So it's going to help it pass through the chest into the abdomen and the body. So it's really that main force of that circulatory factor. And the aorta is going to originate from that left ventricle. Now we know the heart is that main circulatory organ. Now that we've talked about those components, we know that there's 4 different chambers and there's actually 2 different circulatory paths. So I'm going to tell you a little bit about and show you some images about these 2 circulation paths. So there's the pulmonary and the systemic circulation. So pulmonary is going to pump blood to the lungs to exchange oxygen and carbon dioxide. So when the oxygen is depleted from the blood, they need to replete themselves. They need to regain that oxygen. So the pulmonary is going to help those red blood cells become reoxygenated. And then we're going to see it go into the systemic circulation, which is then going to help deliver that oxygen-rich blood and nutrients through the entire body. So I have some images here, and I pulled these from chapter 7. Again, that's in your veterinary assisting textbook. That's the orange one. And this is just looking at, we have that pulmonary circulation, getting into systemic, coming back to pulmonary. So going around the body, systemic or circulation going around the body, carrying that oxygen-rich nutrient blood. Then once it's depleted, it's going to come back to the heart, get pumped into the lungs to reoxygenate, and then going back. So it's a continuous cycle. Now, getting a little bit more advanced with the cycles here. So again, looking at, this is the pulmonary versus systemic. So moving through different arteries, capillaries, veins, and going around. Now, if I want to get even more specific with it, I'm going to look at the exact atriums, valves, ventricles that they're going to be flowing through. And again, we know that our blue is the pulmonary and the red is the systemic. So just exactly how kind of complicated that blood flow can get. But all of these processes work together to reoxygenate the blood and flow that oxygen and nutrient-rich blood around the body to have our successful circulatory system. So as you can see, if there was one little problem here, one little loss of chain in this mass chain of events here, it could cause big problems for our patients. Now, with the heart, they do have arteries and veins that are connected. So really one of the big differences between the arteries and the veins is the arteries are going to carry blood away from the heart, as veins will carry blood into the heart. With our arteries, they're also responsible for the blood pressure in our patients, and that's how we're going to be measuring the blood pressure, is we're going to measure the arteries. So we'll put a blood pressure cuff onto our patient, and we actually have really great blood pressure cuffs that can connect to our EKG machine. And I'll talk about that a little bit later, what EKG is. And it will automatically tell us what the blood pressure is in our patient. Now, when we see an increase of blood pressure, so a high blood pressure, that means that our patient's arteries are in vasoconstriction. Now, vasoconstriction means that the diameter is going to, of these arteries will actually contract and decrease, which will then increase the blood pressure because there's not that much room that they have to move through. Versus if a patient has decreased blood pressure, we're going to see vasodilation. And this is when the arteries are going to dilate. So they're going to relax. The diameter of these arteries will then increase, which means that the blood pressure will decrease. Now, you guys, when you see this BP, that's just abbreviated. BP is blood pressure. Now, when we're looking at the veins are much thinner and they are less muscular than arteries. Our veins, however, they do contain valves. They're going to help keep the blood flowing in one direction. And again, we know the valves, they're responsible for opening and closing with the sinus rhythm of the heart. And just to highlight that pulmonary vein, that is what's responsible for carrying that oxygen-rich blood into then that systemic system going throughout the body. Arteries also have those pulse points where the veins, we're not going to really feel that. Getting into the normal heart rates for our patients. Now, in veterinary medicine, we're going to have a large variety of patients that we deal with, anywhere from large to small animals. So to go over just some examples here, and this is just some, basic ranges of the normal heart rate. Now, we might see that some patients will predominantly have lower versus higher according to their breed or to their size. So for example, our dogs, the normal ranges we're going to see is 60 to 120. But if it's a larger dog, I'm going to expect it to be under 100. If it's a smaller dog, it can actually get up to 140, and I'm not really going to be that concerned, especially with it being a smaller patient. Now, our kitty cats, they're significantly higher than our dogs. Their normal heart rates are going to be around 160 to 240. And guys, before I go any further, you see this BPM over here. What does BPM stand for? What's BPM? What is that measuring? BPM.
Beats per minute?
That's correct. That's beats per minute. Absolutely. So that is how many beats the heart is beating in one total minute. So that is how we keep track and record these vitals for our patients. And when you're doing that, you're actually going to be taking your stethoscope and listening for 15 seconds, and then taking that number that you counted and multiplying it by 4. 15 seconds times 4 is 60 seconds. It's a lot easier to take your reading and more accurate to take your reading in a smaller window and then multiply it up. And again, you'll get to do this in lab, you guys. And I do recommend getting a stethoscope of your own if you don't have one, and practicing on your own animals or friends' animals to help with it. It's obtaining heart rates and getting comfortable with it is something that's going to take a lot of practice and time, especially when you're listening to like our cats, where you can have these cats getting up to 240 beats per minute, which is really, really fast. So that means that within that 15-second window that you're listening to the heart rate, you could count 60 beats. That's a lot. So definitely takes a lot of practice. It's not something that's going to come right away. So I highly recommend getting your own stethoscope and practicing at home or in lab. We are going to be starting lab up, and I'll go over details about that later. But again, something that's acquired with time. Now, getting into more of our like pocket pets, we have our rabbits and our guinea pigs, and they are also at a faster rate. Our rabbits run anywhere from 130 to 325 BPM, as our guinea pigs are around 240 to 250 BPM. Getting into our larger animals, we're actually going to see the heart rate massively decrease. So with our horses, they're going to be around 30 to 40 beats per minute, which means that you could be counting 8 to 10 beats in that 15 seconds. So very, very slow. And again, you guys, these are like resting heart rates. These are normal resting heart rates. So of course, if the horse was exercising, it's going to increase. But if we were resting, standing. Cows are going to be a little bit higher than horses. They're around 60 to 80 beats per minute. And those are the same as pigs, which again are 60 to 80 beats per minute. Now, chickens and poultry, they can actually have quite a high heart rate, running around 200 to 300 beats per minute. And that's going to really depend on the breed of the chicken. And then our sheep and goats, they are very similar, and they will run around 70 to 80 beats per minute. Now, when we are taking our stethoscope and we are listening for this beats per minute, we're getting that measurement. We're also going to be listening to the sounds of the heart. So what we are listening to is the closing and the opening of the valves in the heart as it's actively pumping. Now, it's called a pacemaker system. This is the system that controls the heart rhythm in our patients, also known as the SA node. So when you listen to these heart sounds, you're actually going to hear 2 heart sounds. The first heart sound you're going to hear is a lub, and the second one you're going to hear is a dub. So essentially it's going to sound like lub dub, lub dub, lub dub. Now, that being said, we're not going to count the lub separately from the dub. So it's not like lub 1, dub 2. It's going to be lub dub 1, lub dub 2, lub dub 3. So it does have kind of 2 beats within one, which can be really confusing. And this is why it is something that getting these heart rates can take a long time to feel comfortable with, especially when the beats are faster. So what you're listening to when you hear that first heart sound, that lub, you're listening to the closure of the atrioventricular valves. When you hear that second heart sound, that dub, you are listening to the closure of the aortic and pulmonary valves. So again, helping that blood pumping through the heart. Looking at just our equipment that we're going to use when we obtain these vitals, we have the diaphragm and the bell that's going to be present on the stethoscope. Now, depending on what kind of stethoscope that you have, this stethoscope here actually is going to be a double-sided bell. And that means that depending on the size of your patient, you can switch it back and forth to which side you want to listen from. So if you had a larger patient, you want to listen from the larger end versus if you have a smaller patient, you want to listen from the smaller end. Now this technician here is taking the heart rate vital on her patient. And as you can see, she's just lightly holding this kitty cat and going right behind the elbow on the side of the chest wall to listen for the heart sounds. Now she's listening from the right side, might not be the best option. I'd probably try the left side first, but who knows? Maybe she tried it and it wasn't the best sound, so she wanted to try the right side instead. Now you'll also notice that she's holding the patient and also getting the vitals at the same time. So you don't necessarily need to have somebody holding for you to obtain vitals, especially with kitty cats, you guys. Cats are very sensitive, and a big part of dealing with cats is knowing that less is more. If you have somebody that's holding down this patient and being really abrasive with these cats, they're going to fight back 10 times harder than we can. And it is just a lot better to let them relax, not hold on to them as much, and do it single person is going to be the best way to take these vitals on our cats. All right, now I want to talk about electrocardiography, which is also known as the electrocardiogram, also known as ECG or EKG. So when we use an electrocardiogram, I am going to be evaluating the rhythm of the heart. So these are actually going to be metal leads, little clips that we're going to clip onto our patient. It's going to connect to an electrocardiogram, which is then going to show us the visual of the heart rhythm. So it's going to take the heart rate, but it's also going to show us how the heart is flowing. If the pressures are going well, if it's rising and falling as it needs to. So we are going to be reading that rhythm. So with that electrocardiogram, measuring those electrical currents of the heart, which is going to give us that, as we know, is that sinus rhythm imagery down here. And sinus rhythm is known to be the normal rate and rhythm for our patients. We want them to be in sinus rhythm. Now, with this electrocardiogram, it's really important. It will help us in identifying problems with the heart. If we suspect the patient has a heart condition or is not having adequate rhythm, we will connect them to the EKG and see to evaluate their heart rhythm. And I'm going to talk about certain letters that are going to help identify the peaks and the falls that relate to the heart's activity and functions. And then I'm also going to show you a video after that's going to have a doctor talking about the different lettering and why we use that with our electrocardiogram. So going over these different letters, we have the P wave, the QRS wave, and the T wave. So the P wave, this is known to form at what we would call the SA node, and it's going to help reflect the flow of electricity through the atria. And this tells us that the atria has received a normal impulse and has contracted. The QRS waves, these are going to tell us that the electrical circuit has traveled through the AV node and through the ventricles, which then will result in the ventricles contracting. Then we're going to evaluate the T wave. And the T wave, this is the most abundant one. And it's going to tell us that the electrical impulse has traveled all the way through the heart and that the heart is now what we would call repolarizing or getting ready for the next impulse to start. So real quick, I want us to watch this video. I am going to have to show you it on YouTube, though I'm not sure it's not wanting to work on this PowerPoint for some reason. So we're just going to go right over here to watch that.
Howdy, and welcome to a how-to video on canine and equine ECG or electrocardiogram. ECG stands for electrocardiogram. It's a simple and non-invasive test that graphs the electrical impulses of the heart over time. It detects minor disturbances in the heartbeat or rhythm. The setup consists of 3 electrodes that create 3 leads. Each lead, one electrode to another, represents a single axis of activity. To create the leads and monitor a single axis of electrical activity, we set the electrodes up in a specific manner that will create dipoles, or a separation of charges. The ECG is a report of the orientation and magnitude of the cardiac dipole from several different points of view, and they change as the atrium ventricles depolarize. Lead 1 is created by placing the electrode on the right arm, which will be negative, and another electrode on the left arm, which will be positive. The second lead is created when placing the electrode on the right arm, which is negative, and on the left leg, which is positive. The third lead is created from an electrode that's placed on the left arm, which is negative, and the left leg, which is positive. Now we will demonstrate for you how to set up and run your very own ECG. We'll have a very cute canine volunteer for the canine ECG and a horse model for the equine ECG. When running an ECG, make sure you are familiar with the system you are using and what additional items you may need. The one we are working with today requires the use of gel on the electrodes, while others may require alcohol or nothing at all. The patient is placed in right lateral recumbency, and the electrodes are placed on the elbows and knees. The electrodes are color-coded and go to a specific area on the canine. The white lead is the right arm, the black lead is the left arm, and the red lead is the left leg. A good way to remember this is white is always right for the right arm, and smoke over fire for the black and red electrodes on the left arm and leg. If the electrodes are not set up correctly, your ECG will look odd, such as the QR.
Now, I do want to say that that's just one way that this technician used to memorize where to place these leads. When I was in school, I remember they said it was newspaper comes before Christmas and the snow falls to the ground. And then smoke rises with fire. So that's kind of a few different kind of study tools that I had or that I was given to help. So you'll hear a lot of different sayings from different people in the field that helped them memorize. But also these EKG leads are usually labeled. So they'll say right or left, so R or L, and then they'll say arm, which is talking about the front legs, or hind, which is talking about the hind legs. So don't worry if it's, with these color codings, they're usually going to be labeled as well.
As complex will be upside down.
So this is our electrocardiogram machine here, and this electrocardiogram machine is very smart. It can, not only will it take our heart rate, which is displayed here, and show the electrocardiography displayed here, this electrocardiogram can also read SpO2 levels, which is the oxygenation levels in the blood. It will take a respiratory rate. And if you have the appropriate leads, you can also have a temperature gauge. If you have a blood pressure connection, you can also connect the blood pressure to this machine. So it can give you pretty much all of your readings in one. And it's printing off over here the result from this electrocardiogram. Not all of them will have this option. Some of them, it's just connecting to your computer software and it'll download.
When doing an ECG on a horse, there are a couple of differences from the canine ECG. The horse will be standing, and the setup and placement of the electrodes is different. It is important to remember where to put the electrodes. To remember the electrode setup for the horse ECG, I like to think red goes with blood, so it must be on the jugular. And white and withers both start with W, so the white electrode goes on the withers. Then you're left with the black electrode, and that one goes on the heart. Now we will hit the highlights on how you read the ECG printout. The first wave is known as the P wave and represents the atria depolarization or contracting. Depolarization is initiated by electrical impulses from the sinoatrial node. The atria contract and fill the ventricles with blood. The next segment following the P wave is known as the QRS complex and represents the contraction of the ventricles. After the SA node simulates the atria to contract, the depolarization wave continues to the AB node, which sends an electrical impulse down the ventricles, causing both to contract. The last component is the T wave, and this represents the ventricles repolarizing, in which they relax, getting ready for the next depolarization wave. We hope this short tutorial has helped you understand how to run and interpret an ECG reading. Thanks and gig 'em.
All right. So again, that was just a YouTube video there on how to read that EKG. Right. So getting back into our lecture here, we have a few more slides in another video, and then that is when we will take our break. So moving forward, I want to talk about the different common diseases and conditions that are associated with the circulatory system. Now, with these different diseases and conditions, they're going to be diagnosed through the use of the physical examination performed by the veterinarian, radiology and imaging, so our x-rays, our EKG, electrocardiogram, or ultrasound evaluation. Now, some different circulatory system conditions can be associated as such. They can be hereditary, congenital, chronic, or acute. So hereditary, that's talking about being inherited as a trait from the bloodline. So whether the parents had it or the grandparents or prior, it's something that was carried down as a trait through that bloodline. We'll also see congenital conditions. And these are conditions that were developed from birth. So something that the patient will have for lifelong throughout and was established at birth. And conditions can either be what we would call chronic or acute. Now, chronic conditions, these are going to be conditions that occur and will gradually worsen over time. So it's not something that's going to necessarily be an emergency right away, but it's going to be a condition that we're going to watch for throughout the progression of that patient's life. And it usually will worsen as they become older. Versus an acute condition, this is a sudden onset of symptoms. So this is going to be caused usually by toxicity or by trauma. So thinking of toxicity, if the patient ate a poison, like rat poison on accident, that can cause systemic failure and have acute symptoms. So it's going to appear within 1 to 2 hours of swallowing that rat poison and can absolutely be detrimental to that patient's health. Or from trauma, if they had an accident like a hit by car or, just was injured in that thorax region, we can see that then be an acute injury. Now, I want to talk about arrhythmias. This is one of the most common conditions we're going to see in our patients regarding the circulatory system. Now, an arrhythmia is generalized by the change in heart or in the heart rate or in the rhythm. So a few different arrhythmias are going to be tachycardia. Tachycardia means that the heart rate is faster than normal, even when the patient is resting. Versus bradycardia, this is a condition where the rate is slower than normal at a resting rate. We can also see atrial fibrillation, also known as AFib, which means that the pacemaker is not working. So irregular heart rate, sometimes skipping beats. We also have ventricular fibrillation, also known as VFib. And this means that the ventricles are going to start firing rapidly. And this is known as the most serious condition. So when listening to a heart rate, the heart rate could randomly just be beating so fast. It usually doesn't last very long, but it can keep reoccurring over and over and over again. There's also asystole, which is when the heart is not contracting, also known as cardiac arrest or having a heart attack. Our patients can, unfortunately, go into cardiac arrest. Now, the most common type of arrhythmia that we diagnose patients with is going to be a heart murmur. And we will grade heart murmurs from grade 1 through grade 4. Grade 1 is being the least severe. Grade 4 is being the most severe. So usually with our patients, we find heart murmurs a lot in small dogs. For example, Pomeranians are known to have heart murmurs and cardiac conditions. So it's going to be chronic. This is a chronic condition. You could diagnose a young dog with a heart murmur as grade 1 as a puppy, and it might take them until they're 10 years old for that heart murmur to reach grade 3 or 4. So long chronic condition throughout the whole life. What a heart murmur is this is going to be the abnormal valve. It's going to produce an abnormal flow of blood. So this is actually going to create a swishing type of a noise upon auscultation. So as you're listening to the heart, we know the normal is going to be that lub-dub, lub-dub. So what can happen when you're listening to a patient with a heart murmur, depending on how severe it is, it's going to be like a lub-dub, sh, la-dub, sh, la-da, sh. So you're going to hear a swishing noise as well as that beat that you're listening to. And again, it could be very minor, but worsen over time. And if our patients do have any arrhythmias, they are considered to be very high anesthetic risk, which means that when we put them under anesthesia, whether that's sedation or general anesthesia for surgical procedures, we have to keep very close monitoring on them, and we want it to be as short as possible because they're at really high risk. Now, another condition I want to talk about is shock. So shock is going to occur when an animal does not have enough blood and oxygen that's reaching the tissues throughout the body. So essentially, the circulatory system will revert. It's not going to be working properly. And shock is going to be a result of trauma, or it could also happen due to a heart condition. And with that, care needs to be provided immediately to these patients within, minutes, within the hour of knowing the patient is in shock. We could be, in a very detrimental stage for them. So what we're going to end this lecture on today is I'm going to show you a video. This is Dr. Jones. He is a wonderful veterinarian who does a lot of really great educational videos on YouTube. His veterinary channel is actually called Veterinary Secrets, and he uses his own pets quite a bit for these videos. And so we're going to watch him talk about what shock is going to look like in the patients and what you should do if your patient or your own animal is experiencing shock. It's also important to know what to look for and how to explain to the clients that might be calling your clinic what to do during transport if the patient's experiencing shock. Of course, they'll need to come to the emergency clinic, but there are things that the owners can do to provide comfort and help ease that process. So we're going to watch this video, and then we will be at the end of the first lecture for this evening.
Would you be able to know if your dog or cat is in shock? In this edition of Veterinary Secrets, I'm going to show you exactly how to tell. The shock is defined as a drop in circulating blood flow to the vital organs. Something underlying has happened. Typically we're thinking of something like trauma, a car accident. There's been some internal bleeding, a drop in blood pressure, a drop in blood flow to these vital organs. It can also be something metabolic, something such as a diabetic low blood sugar, hypoglycemia, maybe with an Addisonian crisis. The point here, though, this is a significant emergency. You need to be able to recognize it immediately if it's happening with your dog and take immediate action. So, for example, with Pippi here, there's a few different things I'd expect to see in shock. To begin with, she'd be acting weak, lethargic, probably non-responsive. Like there's something not going right here. And the next more common sign you're going to see is changes in your dog's gum or your cat's gum color. So most dogs who are not in shock are going to have a nice, healthy pink gums. Pippies here, they're a nice, healthy pink. But if your dog is in shock, I'd expect to see those gums very pale, maybe even whitish. The next thing you're going to check is a thing called CRT, or capillary refill time. And once again, this is a measure of the blood pressure. So to do that, we're going to lift up your dog's lips again. We're going to look at their gums. And you're going to put your finger on top of the gums and see how quickly it takes for that pink color to return to normal. Generally, you expect it to be less than 1 to 2 seconds, 1/1000. If less than a second, meaning Pippi has more than adequate good blood pressure. When a dog is in shock, they don't have that. They've got a really decreased blood pressure, and that's going to be upwards of less than 4 seconds. And if that's the case, that's the real big indicator. Your dog is in immediate shock. They're going to need immediate veterinary care. There are other things that you might see. Typically, these dogs and their cats in shock, they're going to have a much higher respiratory rate, so they're breathing a lot faster. The extremities can feel cold to the touch because what's happening is the body is diverting blood flow away from all the extremities, trying to focus on just the essential organs. If you guys are also able to check your dog's blood pressure, that would be ideal. Typically, too, in shock, we're gonna see a dramatically lowered blood pressure. The easiest one to palpate is called the femoral artery. So that's inside this big bone here. This is Pippi's femur. So the inside of the femur, you just run your whole four fingers along the inside. See if you can actually feel a pulse now. You're going to put your thumb on the outside, all the fingers on the inside, and put moderate pressure. If you're feeling a pulse there, that's called the femoral artery. Once again, you can just feel what it is like to be normal. In a dog that's in shock, it's really difficult to feel that femoral pulse. It's going to be very weak and very thready. As well, too, your dog or your cat's going to have a much elevated heart rate. So you can just put your hand on the inside, especially the left side, feeling where the heart is. Easiest is on the left inside of the left armpit. Stick your ear there and just feel the pulse. If it's really rapid, once again, that's more likely a sign that your dog or your cat is in shock. So say you've done all that and you're sort of wondering, what can I do? First thing, you've recognized it, and ideally you're getting your dog or your cat to a veterinary clinic as soon as possible. In general, shock is something that needs to be treated by an emergency veterinarian. Typically means getting your dog on IV fluids, elevating that blood pressure so we can return normal blood flow to the critical organs. But in the interim, there's 3 things you can consider doing. First of all, you want to keep your dog warm, your cat warm. If it just means wrapping them up in a blanket, so be it. If you have something, like a hot water bottle that you can fill up and then put into their groin, once again, that's going to elevate their body temperature. Second, if your dog is still alert enough to swallow, it would be fine to force some fluids. If you have a syringe or something, to get some fluids into their mouth so they can get in additional volume. What we're trying to do typically is increase blood volume. And by doing that, we're doing it with IV fluids. But if all you have is, fluids and water in a syringe, so be it, just go ahead and use it. as long as you're not forcing into your dog and they can swallow. And the third thing would be giving Pippi something that she likes, food, but in particular, it's honey. We're giving your dog, your cat, something sweet. It's not uncommon to have a low blood sugar associated with shock or even primarily being a primary cause of shock. So if you have some like easily absorbed sweetener that can be put on your dog's gums, your cat's gums, feel free to use that as well. So with the dog like Pippi, I'd be giving her, 1 tablespoon, just rubbing it on her gums. A smaller dog, 1 teaspoon. Food-driven hound. Yeah. Finally, the video session has ended with something good. There, Pippi. Yeah. It's not all bad. Oh.
So again, I absolutely adore this veterinarian. Dr. Jones, he is great. His sweet puppy Pippi, he uses her for a lot of example videos. And usually, unfortunately, when our patients are in shock, they're not going to be eating we usually use Caro syrup, which again, that's just a different type of corn syrup to help increase that blood glucose level, the blood sugars. And usually with those shock patients, we're going to have to lift up their gums and smear it along their gums. It'll then soak into the mucous membranes and get right into the bloodstream. Ideally, we'd love it if they would lick it off of a spoon. She's nice and healthy and feeling great. Unfortunately, when they're in shock, we're going to have to manually apply it. All right, but with that being said, that is going to be the end of the lecture for the circulatory system. Again, I took all of the information directly from the course textbook, specifically in chapter 7. And if you guys have any questions, you can feel free to type that into the chat. Otherwise, we're going to be ending for this lecture.